Welcome back to The Wellness Effect. Remember to subscribe to our channel and hit that notification button so you can stay in touch with us and can enjoy all our educational discussions. Today, we put the spotlight on spinal conditions with Dr. Shivam Bhikha as our guest. And no, we're not looking at spinal injuries, but at conditions that can develop over time. Welcome, Dr. Bhikha.
Thank you, Seth, for having me on your show, and greetings to all the viewers.
So, Dr. Bhikha, before we start, could you maybe define for us what spinal health is?
When considering spine health, even back in the ancient Greek days, it
Yes.
was the father of modern medicine, Hippocrates, that actually coined the term that to look at a man's health, look deep into his spine. And I think nothing has actually changed in that sense. You know, the health of the spine still remains such a pivotal role in our general health and our general well-being. There are various disciplines or professions that are actually created around spine and spinal health. For example, there are chiropractors, there are biokineticists, physiotherapists, and then you get to the surgical disciplines. You have your pain management specialists, your neurosurgeons, your orthopedic spinal surgeons. And all of these disciplines focus around maintaining a healthy spine.
Yes.
So the spine is essentially made up of bones, muscles, and the function of it is to assist with movement as well as protection of the vital spinal cord that runs within the spine. So all of these disciplines are developed to maintain function and to maintain the correct purpose thereof.
Yeah.
And you have various pathologies that actually present within the spine. And that can be from a varying age group. We see pathology from as young as a newborn baby right up till geriatrics and your elderly.
Wow.
So there's different pathologies that present at different age groups. And I speak from the perspective of a spinal surgeon.
Yes.
And what I see in my daily practice.
So other than trauma, what are the common spinal conditions that you have to treat?
What we see in a younger age group is often children that are born with deformities within their spine, or the deformities then develop later on. So something that that we deal a lot with is called a scoliosis deformity. So it's in simple terms an S-shaped or 3D curvature that happens within the spine. And you know, it can be very technical in terms of when these develop and when they present within the child. But the more common one we see is the idiopathic or the unknown cause one. And often it's highlighted by the child's family or friends, where they notice that there's actually something wrong with the child's spine, where they develop that there's a change in shape of the spine.
Yes.
And that's when they then present to a GP that then further then refers down to a spinal surgeon. So we've got also different treatment modalities for this. We often then start off with some conservative treatment, monitor it, and later on, if need be, we do surgeries for this. Later on, what patients then do present with. So if you have a young, fit, active patient, they can then present with something where they might have an injury related to lifting something heavy, or at the gym, they feel a pop in the spine, have then difficulty in walking, difficulty in urinating, etc., something of that sort, present to the doctor. And what we often see is a lumbar disc herniation. So where within your spinal vertebrae, you've got discs, and a piece of that disc actually protrudes and puts some pressure on your spinal cord and affecting certain nerves. And we would then do some special investigations, find out what might be wrong, and treat them further. Other conditions that we see in spine are infections. So we deal with a lot of infections. It can be bacterial, it can be TB. So we do in fact deal with a lot of TB of the spine, and this is actually a very well-known disease entity, and we do see a lot of this in South Africa. And we've got special treatment modalities that allow us to treat this. Sure. Something that we see in a lot of our patients is spinal cancers. So there are several cancers that can develop directly from the spine itself, as well as metastases. So very commonly are patients that present with cancers in other parts of the body, for example, breast, thyroid, lungs, and so on. And this cancer then spreads to the spine. And then it's our job as the spinal surgeons to evaluate the patient, evaluate the need for surgery or not, and whatever other treatment might be required. So the other pathology that we see in our elderly population is spinal degeneration. Essentially, the spine is made up of several joints.
Yes.
And the same way where you can get arthritis in any joint of the body, the spine also gets arthritis. And as one ages, you lose water content within the discs of the spine. This then has a cascading effect on the rest of the spine and sort of pushes on your arthritis. And this arthritis can start off to be very mild, just with a patient presenting with mechanical back pain, eventually leading to such a point where they have difficulty in walking, they have difficulty in passing urine, etc. And we need to understand that this can then be a more serious condition, and that may later then warrant surgical intervention.
Doctor, do you treat a lot of spinal trauma patients?
Spinal trauma is very common. We see a lot of high-velocity car accidents, a lot of occupational injuries where patients fall from heights, etc. And then we deal with the spinal trauma in that sense. I mean, we do see some lighter trauma, and then you have your more devastating end of the spectrum where patients have quite serious injuries, leaving them paraplegic or quadriplegic, So, and then that's also one end of the spectrum of patients that we deal with.
So, doctor, we've been told our whole lives to sit up straight, as we're doing right now. But does that have an effect on our spinal health?
So, yes, most certainly it does. There's a concept or theory that has come up, and it encompassed in what is called back hygiene. And this encompasses correct posture, sitting up straight, and it has to do with your daily activity. So in your leisure time, when you're sitting and watching TV, what's your position, as well as occupation related. So there's a lot of occupations that are, you can say, high risk or hazardous towards developing pathology for your spine. So I mean, I've seen a lot of patients that are IT professionals that are sitting behind a desk for, they say, 6 to 8 hours nonstop, and a lot of them do, present with back pain and present with neck pain. I've seen some dentists that report the same. It's posture related. So just getting back to your question about back hygiene, yes, I think back hygiene is something very important, and the main or the key thing in preventing all of this is actually being physically healthy. So maintaining good general health. So that's something very important to manage, as well as managing your weight.
Yes.
That does actually play a role in joint health as well as your spine health. And then correct posture, keeping fit and healthy, and regular exercising together with stretching, incorporating stretching activities. Very, very big now is Pilates and yoga and all of those kind of fields that have come up. And I think that's something very good to incorporate. It's stretching your muscles, strengthening your core, and just keeping good general physical health.
Thanks for the tools that you mentioned and things that we can do. Let's talk about treating a spinal injury.
When it comes to treating a patient, and most often we see a patient that comes to us with back pain.
Yes.
So that's your most common presentation, and in fact, statistically shown, it's the most common presentation to the GP, the casualty, and then gets down referred to the spinal surgeon. And so we have a few steps in what we do or triage in terms of managing this patient. The first thing that's developed is called red flags. And there's a set of questions or line of questions and examinations that we do in order to identify whether there's some more sinister pathology going on in this patient, or whether it's just a mechanical back pain or a muscle spasm. So some of these are a dramatic or drastic weight loss. So if a patient presents to you and they say, "But doctor, I've actually lost a lot of weight," this gives us a clue as to something more sinister going on. For example, an infection, a long-term chronic infection, TB, for example, or cancer. Then if a patient presents with night pain, you shouldn't actually be having pain at rest. And pain at rest is quite a sinister sign of something deeper brewing within the spine and warrants further investigation.
Sure.
Other things is extremes of age. So very young children, elderly shouldn't be having, it warrants further investigation when they present to you with back pain. And as well as bladder and bowel function. So if a patient presents to us and they say that, you know what, I've got this back pain associated with dysfunction of my bladder and bowel, that's quite sinister. So when a patient presents to us, we do a thorough history, a thorough clinical examination. There's many tests that we do. We test the different nerves within the body to see if there is any issue. And then we move on to special investigations. This includes X-rays, CT scans, and MRIs to give us a better clue of what actually might be going on. If we feel that a patient doesn't actually warrant any urgent surgery, our first line of treatment is always conservative. So when I say conservative treatment, I mean we start off with analgesia, so pain medication, anti-inflammatories, and then we use a multidisciplinary team approach. So with that, I mean we use physiotherapists, biokineticists, occupational therapists. This forms our team. And the patient should go through treatment via these modalities as well.
Correct.
And that forms part of our multidisciplinary team. Part of this, then we can later look at injections within the spine, obviously depending on the condition, injections within the spine. And if the patient then does warrant surgery, then we then consider surgery on the patient, depending on what's the need. And speaking about surgery, is that in our modern era of medicine, things have evolved so well now and so fast that, yes, we still do open spine surgery where the patient is in our theater, we open the spine, and we do need to work on the spine in an open sense. But the modern or fast-paced way of doing it is now actually endoscopic work or via robotic surgery, as well as navigation, robotic navigation surgery. So there's so many advancements that are actually happening in the field of surgery and
it's incredible.
in medicine right now. Yeah.
So we spoke about spinal hygiene for a moment, but what are other things that our viewers can do to prevent any spinal-related injury conditions?
So the back hygiene comes as part of that. So it's maintaining good health. If you have any chronic conditions, so for example, diabetes does put you at a higher risk of spinal pathology.
Correct.
HIV does put you at a higher risk. So you got to make sure that your chronic conditions are actually well controlled and that they are put within good limits. So you maintain good physical health, maintain a good body mass index. So you maintain a good weight, and as well as then you're exercising regularly, your stretches. You should be gymming regularly as well within a safe limit, and maintain good physical health. That's essentially it.
Thank you, Dr. Bhikha, for such an engaging and insightful conversation.
Thank you so much. It was certainly a pleasure chatting to you.
And thank you for joining us. Subscribe to our YouTube channel and hit that notification bell so you can catch every episode of The Wellness Effect. See you next time. BankMed, the medical scheme of choice for the financial services industry. The Wellness Effect is proudly brought to you by BankMed, yours in good health.